We also tested some random products from the market, and we also got some of the products for testing. There is no IPA in that. When we see from the market, uh, every person is trying to sell sanitizer because that is need of her, and they're just filling anything which is possible, and they're trying to convince people that this is IPA.
So, Prashant, welcome to the show. So, the podcast name, so this is a podcast format show. So, the name of the show is Hygiene Theory. And what this is that we conduct weekly interviews with the topic surrounding hygiene and infection control in the domain of healthcare. So,
Okay.
what we believe is that with this kind of content being out there, people can understand that, a bit of, conscious about hygiene can prevent the spread of germs. So, we believe that
Definitely.
someone from the field, if they know how much the problem is and what
Mhm.
people can learn out of that, then that would be really helpful in, preventing the spread of the germs. So,
Yes.
Prashant, if you could quickly introduce who you are and what you do, that would be really helpful here.
Definitely, Akshay. Thanks a lot. That's a very nice name to the program, man. That is something which is need of our. So, to tell about myself, I'm Prashant. I've done my master degree in life science, microbiology, and I have worked for majority of the MNCs in South India. So, as a microbiologist, as a compliance expert, implementing global scale strategies to effectively follow the compliance. So that is what I used to do 7 years ago. Later, myself and my other partner, we quit the company and we started IncepBio, considering providing very niche and unique services which will add more value to the healthcare and pharmaceutical and food segment. Okay, so majorly into the area of compliance testing, chemical testing, microbiology testing. That is how we started in SubBio. And today's date, we provide a very wide range of services. Not just doing the testing activity. We also consult on what exactly the company should be focusing on and what is the need of how they can present the results in a much better way to the customers, so that actually they add a lot of value in everyday being of all the people. That is what we do, Akshay.
Got it, got it. So, yeah, out of all of the services, you also offer air, quality testing. So, I
Yeah.
wanted to know in the last 1 year where the spread of COVID has happened through air, a lot of studies have come forward and they have claimed and they have proven that COVID spreads through air. Even the recent Lancet study proved that COVID infection is through air. So what
Yeah.
has your experience been in the last 1 year with respect to air quality testing and how the COVID is spreading through air? What are your experiences of that?
Definitely, Akshay. If you consider the initial days of pandemic previous year when it started in the month of March end, so people started understanding the importance of air, especially the air what they breathe in the office area, because these are in closed environments. So that is a kind of a incubator for the virus also to spread very rapidly. The virus as such itself is not free floating in the air. It is always associated with a particle. So when we
Okay.
speak, the aerosols which are generated either by particles or saliva particles. So what happens is these microorganisms can sustain starting from 5 minutes to 5 hours to 5 days, depending on type of microorganism. But when we are particularly speaking about COVID S, we do got a lot of queries wherein people wanted to understand, how long this microorganism is surviving in the air, how exactly is spreading in the air. But overall, if you see, the people who were, in the initial days, who were not really keen on understanding the spread of the microorganisms or even the general air quality, suddenly became very cautious to understand, what is their indoor air quality, how exactly they can improvise it, what kind of testing I can get it done. like hygiene monitoring, so exposure of the plates, or understanding the SOx NOx, so by indoor air quality machines which we have. So all these things suddenly started shooting up, and there were a lot many studies on the the AHU studies, the light intensity studies, and many of the products coming into the market claiming that they can
Yes,
kill or neutralize viruses and other
yes,
microorganisms. Specifically, they can target. So we also work with some of the MNCs to understand how exactly their product is impacting on COVID-19.
yes,
So if you ask me in general, suddenly there is a need of this testing and need of information to people to
yes.
understand how exactly they can improvise their daily living.
Right. Very important point is quality, the indoor air quality, right? And a
Yes.
lot of people have to be aware of the quality of the air in their homes, in their, in their offices. So a lot of issues are coming up. Even there are a lot of fire hazards happening. Recently in Maharashtra, there was this case that suddenly an ICU it had caught fire, and then the result later was we got to know that it was because of use of chemical sanitizers that they have been spraying over time and time again, and there was barely any airflow in the ICU. So the alcohol content just settled on the ceiling, and then that triggered this one small short circuit, caused the whole ICU to get fired. So that is very important. So now people are understanding, they need to test the quality of the air, what is there in the air, is it toxic, it is non-toxic. So coming to the point of having these, like now if we understand air would be a medium that can be used as germs to spread. And even right now, what we are able to see is that the hospital acquired infections, they are getting more and more every single day. How big of a problem is a hospital acquired infection, and what is the need of the hour to control that hospital acquired infection?
Akshay, you have pointed out the biggest problem which is happening not just India, globally. Please understand this as you gave the example of this ICU. Even I have read about it. It is so unfortunate, most of the people, they are utilizing the situation just to make money, and they are trying to sell every possible carcinogenic and hazardous chemical, which are very hazardous, and they're also flammable. So what happens is IPA, it is always used in a regulated environment at a particular percentage. But what our people are doing is they are just seeing media and somebody following something in YouTube. There is no SOP for this. They are randomly following it and spraying all these hazardous chemicals every possible way. They are putting it to duct. They are spraying on the human beings, on the skin, whatever possible way. So this is something which is very crucial that people understand that that is not how it is done. There is always a procedure. Any chemical you buy, you get MSDS.
Yes,
Okay, so material handling data safety. So you go through that, you understand what percentage I should use, what is the time, and duration I should expose the room with these chemicals, and how exactly, not just spraying, after spraying, how exactly to neutralize these chemicals. There is a procedure. That is what people exactly follow it. However, the other important thing what is spoke about is the nosocomial infections, what we call a hospital-borne, disease, especially through microorganisms. We call it as nosocomial infections. This is something very important because if you see the recent, not just COVID, see a person would have got RT-PCR positive results, might be because of mix up of sample or anything. Even if he is false positive, he is getting admitted to the hospital. If there are COVID positive patients and he inhales the same air as you are rightly recommending, yes, COVID is passing through normal air also, then definitely there is a high risk that this particular patient can contract COVID. People need to do today is, yes, it is a crisis situation, it's a pandemic which has hit our country, and it leads to a lot of chaos in the, especially the healthcare segment. But however, with the proper SOP in place, wherein government can approve, these are the only what you say chemicals, or we also have a lot of non-chemical products, probably from Ayurveda background, which are also proven effective on COVID-19 and other disease causing agents. So if a proper SOP is put in a place wherein everybody follow the same procedure with the same time duration, for example, in a day 3 times and for a duration of 1 hour, and this is the way you need to fog it. These are the areas, critical areas you need to cover. And if you want to spray these particular fogging agents in the AHU, are there any hazardous chemicals, or are there chemicals or extraction from the fruits or Ayurveda products which can be used, which are less hazardous, but also it boosts the immunity of people, something like that. If a common procedure is followed in all the hospitals, we can effectively implement the disinfectant strategy. One, also the most important thing, after some time you'll get a valid a data which you can validate. So we followed these fogging procedures. We followed a disinfection program with such a such concentration of the chemicals or a product XYZ. So then what we did, this is how we can bring down the complete concentration of the COVID in the air or other germs in the air. So you can validate the data after some time for sure.
What is your opinion on natural and organic products in maintaining hygiene as compared to chemical products out there?
This is something what we have done in recent times. From past 1 year, at least 5 to 6 organic disinfectants we have tested. And trust me, uh, we as such India use a lot of Ayurveda products, and definitely we have a lot of experts in this domain who can extract the antimicrobial agents from the naturally occurring fruits, vegetables, all the green vegetables, all these things. So even those, we found that the normally what the procedure we follow of ASTM, AITCC, or FDA guidelines or antimicrobial effectiveness testing, when we use the same products along with the normal chemicals also, which were previously approved, we got very good results. In fact, in par with the normal bulk sold chemicals, which are also hazardous. So we could see that it doesn't matter whether it is from an organic background or from a chemical background, but both were giving the same results. But at the same time, the one more important thing here is, when I say the normal chemical, most of the chemicals are hazardous. And when I say a product is extracted from an organic, food product or organic vegetable, then it is already we understand that this is something much safer compared to a normal chemical. So in that way, what I can say, Akshay, so how the market reacts is, people already know the bigger brands who are giving the chemical disinfection or chemical, hand washing soap, everything. So pe- people first tend immediately to go and use these products. But however, in a right way, if even our organic products, which are proven and which are effective, because we have tested and I have the data, that is the reason I am telling you this very openly. If it is also marketed in a right way and communicated to people, what are the benefits compared to the normal chemical disinfectants or sanitizers, what are the exact benefits people can use on a longer run. For example, the skin can be normal chemicals can take out a layer of your entire skin, but however organic compound, we all know, we can use it for a much longer time. And even if you inhale organic compound, I'm pretty sure there won't be any very adverse events. But normal chemical fogging, you'll be very much aware, like hydrogen peroxide or something, even by accidentally you inhale, the consequences. People go to shock, trauma, when they directly inhale normal chemical fogging agent. Whereas the organic compound, so even we have tested in chambers and everything, and we could see that easily we can still breathe and do the testing, and it was more user friendly to handle these organic compounds. Akshay.
There is a perception that alcohol must be there in a sanitizer. Organic brands with a non alcohol based sanitizer are finding it difficult to convey that the main aim is to kill germs. So, how do we bring about this change in perception in a customer's mind?
Yeah, actually, as you rightly said, again, people go with whatever they see in the media, like you should use 70% IPA only, or you should use particular brand. All these things are fine, but one thing, the most important thing, what you told here is the idea here is to kill the germs. It doesn't matter whether it is 70% IPA. There are much more carcinogenic agents like even a small exposure to hydrogen peroxide, or there are other parabens, aldehydes, glutaraldehydes. There are so many, disinfecting and also sterilizing agents. But when you say the organic compounds, so again, what I want to insist here is one thing is getting IPA at this scale is something which is very difficult. And trust me, we also tested some random products from the market, and we also got some of the products for testing. There is no IPA in that. They have either used starch. There's not even an IPA smell, because we do a lot of testing even for the presence of IPA. There are a lot of testing methods to exactly understand whether it is 70% IPA or not. So all these things, when we see from the market, uh, every person is trying to sell sanitizer because that is need of her, and they're just filling anything which is possible, and they're trying to convince people that this is IPA. So what I recommend here, one thing, yes, if you want to really buy a product, please try to understand what is the certifications they have, and whether it is from a brand which you can trust. One thing. At the other same point of time, if you say, when organic compound, when it is giving the same results, desired results of killing the germs, and it is also going to be much safer for you to handle. So you can choose, or you can choose the combination of these ways. Probably one time of the day, or whenever you're going outside, you can use one type of sanitizer. And today, when you see, most of the people are, they want to go towards environmental friendly products. So if you ask me, which one is it, whether it is a chemical based sanitizer or organic based compound, or like having alkaloids, flavonoids in their product to kill the germs, definitely you have the answer. Which one is more environment friendly will be our organic compounds.
Do you think there has been any neglected precautionary measures which you feel if it had been implemented, the second wave could have been tackled better?
Definitely, Akshay. One of the most critical point here is, if you see the first wave when it happened, there was a proper, quarantine procedures which was laid down, and also here in Bangalore, we have all also observed that most of the places, even if a single house is got a COVID patient, automatically they used to seal down the area, and they used to disinfect regularly those areas and those houses. But what happened is, slowly, once the unlocking started last year and people started resuming to their normal lives, things were being neglected left and right. So people were not very cautious about following the disinfection process or hand sanitization process, or for that matter, even taking some basic kind of immunity booster medicine, everything. So everything went off because people started assuming that there is no corona, there is no COVID, we have better immunity. I think it's for India, it's done. We have overcome the impossible. With that mindset, everything started. All the functions started, all the big scale events started. So that was something could have been controlled, and at the same time, people by themselves also neglected, not wearing the mask in public areas, not following the proper sanitization procedures, or even when they come to know particular house is having COVID, not a proper disinfectant protocols or isolation protocols or quarantine protocols were followed. So I'm pretty sure, Akshay, the protocols were there, but people started neglecting it. And definitely, as a community, when we all follow best practices, I'm very sure probably we could have avoided this particular second wave. But however, as you rightly mentioned, with better systems, better control in place, things could have been, handled in a much better way. Akshay.
What, according to you, are some of the critical sectors apart from healthcare where maintaining sterility is key, but it is neglected or ignored?
No, yeah, definitely, Akshay. One of the immediate segment wherein more precaution need to be taken care is food industry. All the hotels, catering companies, and also the one place, where a closed environment is there, wherein, there are no windows we do understand, for a corporate sector that will be very tough to, open their windows and start doing something. But however, these are the areas, if they, put better systems in place to, not just COVID. I always used to stress, not much before COVID, that see, we need to put certain systems in place so that all this, like we spoke about, cross contamination, the germ, moving from one person to other person. In order to avoid all such kind of instances, if we can, control all the, spread of the germs by putting strong protocols in place. Either it might be disinfection of the rooms on regular intervals, probably once in a month, once in a week, depending on, size of the industry what you are into. And when we speak about food industry, not all the foods are sterilized. They are probably pasteurized or, sometimes just processed. So more precaution need to be taken in these segments, wherein they can also, if not handled properly, the COVID by itself can also spread through these food products, or, from a catering company. Even one person is ill, then, it is a catastrophe. Things will go haywire, and it will be very tough to control. So these are some of the industries, Akshay, I think need to be taken care of immediately and on top priority, so that the further spread, or we can also avoid the future waves.
Given the current economic situation and extended lockdowns, do you feel organizations would consider investing enough in improving hygiene?
Akshay, you have seen the result when you don't prioritize your hygiene. You already know about it. What is that we are going through? We are all suffering. The businesses are suffering. The community is suffering. People are dying. So let us put it in this way, rather than telling that hygiene is a luxury, hygiene should become your daily routine. Hygiene should become a standard protocol in your process. Hygiene should guide you to deliver a value to all your customers. Hygiene should help to understand that, as a community, when we follow hygiene and all the hygiene process, in what way we can avoid such kind of instances wherein spreading of not just COVID. See, COVID is one of the microorganisms. There are cross together microorganisms in the vault. We never know when the next thing will come. Okay, I touch wood, nothing should like that happen. But what I'm trying to say here is, you know, germs, and these are germs are called as microorganisms because we cannot see them. And when we cannot see them, and if there is a system in place which can kill effectively these microorganisms, it is always suggested that use that particular protocol, or, as you rightly mentioned, sanitizer or disinfection study, disinfectant, or every routine, every single detail matters a lot here. So to answer to your question, it's not just a part of, what you say, it's not a no more a luxury, Akshay. It's a, need of a, and it should be put in your daily routine. That is the only possible way wherein system can take care of such kind of pandemics.
Thanks, Prashant, for coming on the show. Do you have any closing remarks?
Oh, it was my pleasure, Akshay, for being part of this podcast. And so, what I suggest now, Akshay, see, there are so many products, there are so many, process which are explained by the people for disinfection or sanitization or immunity boosting. There's so many things. But what I can suggest, all the listeners here is be very careful what product you are choosing. Be very careful how exactly you are going to make it a daily routine, a daily practice, and also please ensure we being responsible citizens and thinking of our own community, our future, and for our kids, let us ensure that whatever we choose are sustainable, which is something greener and going to benefit our environment rather than harming it. That is what I can suggest, Akshay.
Thanks, Prashant, for coming on the show.
Thanks a lot, Akshay. Thank you, Nitin. Thank you. Thank you, man. Take care.
Thank you, Mr. Prashant. Thank you.
Yeah,
Bye.
thank you. Bye.